Sometimes the pancreas gets swollen and leads to a condition called acute pancreatitis. Unlike acute appendicitis, where the appendix is again swollen, becomes red, acute pancreatitis is a serious condition and which cannot be ignored. We do see almost a case a day in our practice of severe acute pancreatitis, and I am sure in a city daily the good number of patients get admitted or hospitalized with this condition. Why do this acute pancreatitis occur? In other words, what is that can damage the pancreas? Actually, we have seen that during times of prohibition in our state, the cases of acute pancreatitis are less, and when the prohibition is lifted up, the cases increase multifold. Likewise, in other states in our country where prohibition is in practice, acute pancreatitis is uncommon. Alcohol in large amounts damages pancreas considerably. Actually, we have seen these cases of acute pancreatitis in times of marriages, when the marriage parties make merry drinking, and also when students travel together on a holiday to a place like Pondicherry or Goa, where they don't drink water, they keep drinking alcohol 24 hours without eating food, and some of them can land up on this condition called acute pancreatitis. How does this occur? How does it manifest? These patients with acute pancreatitis have severe abdominal pain. Quite often this has been misdiagnosed as gastritis, and they tend to swallow some antacids and some tablets and get some injections from local doctors who do not really suspect this acute pancreatitis. But if this pain doesn't come down, or the pain increases or goes to the back where the patient has to bend forward for some relief of pain, one should likely to diagnose acute pancreatitis. How was this diagnosed? Quite often a blood test in form of serum amylase and lipase will give a clear indication that the patient has acute pancreatitis, and this is usually substantiated by a CT scan, which will show that the pancreatic gland is swollen and a patient has got acute pancreatitis, and it also tells us the severity. Majority of the patients with acute pancreatitis may not require any major treatment, but definitely they should be seen by a specialist physician in a specialist hospital treating pancreatic diseases. Some of them get away with very minimal symptoms and go back home, but some of them would require intensive care treatment, because acute pancreatitis can damage the lungs, it can damage the liver, it can damage the kidneys and also the heart, so much so that these patients might require blood pressure raising medicines, they may require a machine to help them breathe, and occasionally they may require a dialysis machine to clear their blood of urea. Some of these patients had to be in the hospital for days and sometimes months together, requiring many CT scans and other blood tests. They require very specialized medicines and some antibiotics, and again after about 4 weeks time they may develop complications of acute pancreatitis, which will include infected necrosis, that is pus in the pancreas, and there may be organ damage in the neighborhood of the pancreas, and this will require sometimes endoscopic treatment, that is through an endoscope by mouth. You can go through the stomach and take that pus off. In certain other patients we had to do percutaneous drainage, that is from the abdominal wall skin we had to put thick needles into the stomach and suck away the pus, and a good number of patients surgery will be required. Surgery in the form of removal of all the dirty or dead tissue of the pancreas, not just once, probably many times this is required, and these sometimes, especially in the corporate sector, the expenditure can run up into lakhs. Again, some of them may not survive all this ordeal, but majority of them can be treated and corrected. So alcohol in large amounts can damage this organ called pancreas, leading on to acute pancreatitis and associated complications, and patients with suspected acute pancreatitis should get into a hospital where facilities and specialists are available who can treat pancreatic diseases, and with a very good intensive care a good number of these patients can survive and get back to their normalcy. Thank you.